We are so honored,
proud,
humbled,
and empowered to work for a company that has been dedicated to the rare disease community for nearly 40 years.
Today, like many of the years prior,
we have found a way to come together
with nearly 100,000 of our colleagues worldwide.
Rare Disease Day is an opportunity for all of us to show our corporate commitment
to continue scientific research for the more than 7,000 rare diseases
and to express our personal support for each of the estimated 300 million people living with a rare disease and their families worldwide.
Rare Disease Day inspires us to work harder,
think more creatively,
and to focus on delivering meaningful solutions for patients and their families.
We at Sanofi will continue to work toward equitable access to medicines.
We will develop new, innovative therapies for people living with rare diseases.
We will strive to eliminate a long search for a diagnosis.
We will elevate the voices of those living with rare diseases.
This is my pledge.
This is my pledge.
Mon engagement.
My pledge.
My pledge.
My pledge.
Mi promesa.
That's my pledge.
It's our pledge. Welcome. Thank you for joining us from around the world for our Rare Disease Day event live. During today's event, we will hear from Vesna, an advocate, parent, and patient from North Macedonia, from Dr. Viri Cano, a pediatric hematologist originally from Mexico, and from Flaminia Machia from Rare Disease International in France. While you listen, I encourage you to use the emoticons like a thumbs up, a heart, some hand clapping to let us know that we really are all together here. And feel free to post questions in the comments. My colleague Vanessa Wolfler will pose some of the questions to the panelists at the end. For us, recognizing Rare Disease Day isn't something we just do one day each year. It marks the renewal of our pledge to improve the lives of those living with a rare disease. We know around the world there are millions of patient advocates, healthcare providers, researchers, policymakers, and industry employees who together form an ecosystem to support the global rare disease community year-round. We all have the same goal: to better the lives of people living with a rare disease. The expertise we bring to this network and the paths we take to achieve our objectives are often different, but together much has been achieved. In the past 40 years, we have witnessed significant scientific progress towards new treatment options. Together, patients and healthcare providers have awakened a new dawn of awareness of rare diseases by educating each other, as well as policymakers, researchers, and the industry. Yet, on average, someone experiencing the signs and symptoms of a rare disease might search for approximately 5 years or even longer before receiving an accurate diagnosis. And as we talk today, more than 90% of the estimated 7,000 rare diseases have no available treatment option. Further, even if an accurate diagnosis is made and a treatment is available, many patients are unable to access the medicines they need. Whether it be due to the intricacies of the healthcare system of their home country, their financial situation, or societal issues that cause inequities. Inequities based on race, gender, education, disability, and other factors. We can and we must do better. Together, we must have a multilateral approach to developing new innovative medicines to treat rare diseases. We must advocate for equitable access to medicines when a therapy is available. And we must provide education and resources in an effort to shorten the long, difficult journey to the diagnosis. We believe, and I believe, the key to accomplishing our shared ambition as a community is by keeping patient voices, stories, and the needs at the heart of our pledge to the global rare diseases community. When I think about my personal pledge, I often think about Erica. Not long ago, I met Erica before she stepped up to the microphone in front of a ballroom full of patients, families, advocates, and industry representatives at the National MPS Society meeting. Her words to the community gathered brought us all along on her personal journey. She made us feel like we all belonged, that we had a place in her story. She explained how, due to living with a rare disease, she had to give up on certain things that she had wanted in her own life, such as motherhood. But she decided that instead of being sad, she would be the best aunt she could be. She chose to be resilient and tenacious. She also chose to be a powerful educator and strong advocate. What I learned from Erica is that even when you're doing your best, you can always do more. And I learned that I can do more. And that is something I carry with me every single day. It is now my sincere pleasure to introduce to you Vesna, who is joining us from North Macedonia. Vesna is a wife, she's a mother, and she's an incredible advocate. She is living with a rare disease, Gaucher disease. And like so many, it took her years, 7 years, to receive a diagnosis. And following her diagnosis in 1991, treatment was not available in the healthcare system in her country. She too decided she could do more. Over to you, Vesna.
Thank you, Shannon. I'm very happy that I have this opportunity to join everybody here today. I'm a little nervous about telling my story, although I have told it so many times over and over, especially in my country, in the national media. But it's still an experience when you tell people about your life, especially when your life is not ordinary, but it's an extraordinary life because of your disease, because the disease is not ordinary, it's a rare disease. But I accepted that this makes me a unique person, and it gives me unique opportunities to meet such wonderful people like I'm having today with you. So my journey, as Shannon already said, started when I got my diagnosis when I was 7 years old. If you can imagine, it was a time without the internet, without the social media. So it was like impossible to get information on the disease, to get contacts with people with families who have that disease. So my parents were a little bit lost in all of that. But finally, they got some information and they shared it not just with the patients, but also with all the doctors, so they can share the right information to the people and not tell them that they will probably die from this disease, like they told my parents. But here I am, 35 years old, still alive, and probably I will get to 90 if a bus doesn't get me over. So when I got my diagnosis, of course, my parents didn't tell me right away. But as I was getting older, the symptoms were getting worse. And in my 20s, I realized that I'm living with constant pain. I have all these bruises on my body. And then when somebody hugged me a little bit stronger, I got my ribs broken. So this is the moment when I realized that my future will not be the future that I want. My future will not be something that I can imagine, because the disease will determine what I do in my life. The disease will be leading the way forward. And I didn't want that. I wanted my own life. I wanted to have a family, to have a job that I want. So I decided to fight for my life, to fight for treatment. In 2009, in Macedonia, they had a program for rare diseases, but they were only treating like 3 people with that program. And 3 people is nothing. So I started writing letters, and then I started telling my story in the media, organizing press conferences. And when I started doing that, I got a lot of calls from other people who have rare diseases, different problems, but access to treatment was the mutual thing that we agreed to fight. So in 2015, we managed actually to get treatment. But before that, I have to mention that my inspiration to get to start this fight was actually a donation. I wrote a letter to the International Gaucher Alliance and also to Sanofi. And in 2010, I got my first infusion. When I got it, it was like a miracle happening, because it was, this cold infusion going through my veins, and I was like, oh my God, this is life happening. This means that I get to choose my future. This means that I can do something with my life. And then my mom called me and said, you know what, you have treatment now, but other people don't have it. And since you are, a very nice girl, you're educated, and you are quite competent to do stuff, maybe you should fight for rare diseases, because maybe this is your destiny. And then I accepted it. She was right. I founded the association with 4 families with Gaucher disease. And today in our association, Life with Challenges, we have 400 families. So the association actually supports 400 families in North Macedonia. And together, they all have different 150 rare diagnoses. So from 1 diagnosis, we got to 150. And from 4 families, we got to 400 families. In 2015, we also got the government to finally give us treatment. 150 people received treatment in 2015. We got over 30 different medicines who were not available in our country. 15 years before that, in Macedonia, we did not have any new drugs. This was the first time new drugs are coming into the country, and it was for rare diseases. And this was because we were loud and we were happy to talk about our lives, about our stories, how it is to have a challenge, to have, all these problems connected with a rare disease. It's impossible to get the system to recognize you as a person who has a problem, and that problem needs to be solved. This is why when we went to the institutions, we didn't just went with our problems, we also went with solutions, because we wanted to be a part of the solution, not just a part of the problem. This was very important to us, because we all know how rare diseases are so different, so individual, and you have to get the institutions to get you a seat at the table. And we have that seat now, and I'm very happy about it. I did not forget about all the people that helped me through the years. And this is why I continued to volunteer for the International Gaucher Alliance. I love them. I mean, I have so many people that helped me to become a better patient advocate and a better person, like Tanya Colin Histed, and like Anna Grete, and Fernanda Torquati and Jeremy. Those are all people who are making difference in the world. And I wanted to be one of those people. And today I am the chair of the International Gaucher Alliance, because I worked, I educated myself. I learned about communication, about public relations, but I also learned about clinical trials. I went through the EUPATI training. I joined Eurordis. So I learned from them, from all of the schools they had. And I also connected Life with Challenges, our association, with all the regional associations. So we have this regional network, like with Serbia and Montenegro and Albania, and we are helping others and they are helping us, because sharing is what helps us to get better, to make institutions listen to us and provide better quality of life for patients with rare diseases. So today I'm a patient advocate. And when I introduce myself, I always say, hello, I'm Vesna. I have Gaucher disease and I'm a patient advocate, because I want to help people to have future. And this is what I do. And I love it, because my job makes me a better person. And I can tell my daughter, I have a daughter. So this is one of the benefits of having treatment. After 5 years of treatment, I got to get pregnant, because before that it was impossible. And now she's 5 and she's amazing. And all the drawings that you see behind me are made from my daughter. And it's very nice when I can tell her that her mom is doing this wonderful job of helping other people. I also help families build other patient associations. I help them with meetings with institutions, how to write the letters, how to find solutions to their problems. And I'm not scared anymore. I'm not the scared, depressed patient that I was so many years ago. And now I'm a strong person, and I want to make others strong. I want to help patients achieve a better quality of life because they deserve that. It doesn't matter how the drug is expensive. It doesn't matter if you are only 3 patients in your country. Your government needs to help you out, because health, it's not a privilege. It's a right that you need to fight for. And if it's not given to you, freely. So, I still keep that letter that I wrote asking for a donation for a treatment. And I keep it because I want to remind myself how it feels to have nothing, to be depressed, to be desperate, to have no one to turn to for help or for information. I keep it because every time I get a new family in this situation, I try to be kind, to help them out with every information that they have, and offer psychological help also, which we have now as a service in our association, free of charge, not just for the patients, but for the families, because we understand that the burden of the rare disease is a burden for the whole family and not just for the patients. So this is my message. Be loud, be strong, do not be afraid of the governments and institutions. Be yourself and ask what you deserve, a better quality of life. Thank you everyone for listening. And now I will move over and give the microphone to Dr. Cano, because she has a lot to talk about as a healthcare provider.
Thank you, Vesna, and beautiful said. Thank you so much for inspiring all of us, especially me with your story. Similar to you, I have held also into tokens throughout my career that keep me motivated and inspired. So my career in rare diseases was not planned. I grew up in Mexico City with the idea and the dream of become a physician. I have always considered that good physicians, they need to be good scientists, but they also need to be greater artists. So you need to have the sensibility and the curiosity to be a problem solving, and that will be given by the science. But you need to be an artist. You need to find a way on how to really understand the patients, how to really be empathic with them, but also how to be creative, not only in terms of how do you give medication, how do you also make those medications available for the patients. So I decided to become a pediatric hematologist because during my career, I realized that kids have just a different way to see the world. They have just a clear and a simple way to face the things. And the other way to really make our world better is to support and to keep pushing for the kids to be a better person and to receive the life that they deserve. So early in my residency program, one night while I was in the emergency room, I received a kid with hemophilia. This is a rare blood clotting disorder. But from these rare diseases, you almost learn anything during the medical school. Not either if we talk about like how to treat those patients. So since that night and up to date, I made a promise to myself that I will try to learn as much as possible to be able to support and to help these patients. So my first move was taking onto a fellowship in the US focused on coagulation cascade disorders. I decided to do this outside my country because in my country, I remember one of my mentors in my initial career steps saying me that rare diseases were not really rocket science, as you only need to give to the patients what they are missing. The challenge comes when there's nothing to offer to the patient, then you only take care like superficial for those patients. But as much as I learn and I understand from these diseases, I can realize that it's more complex than everything that we can think. Each of these diseases will impact the organs, the systems of the patients. If you talk about a kid, as Vesna said, you will impact the growth of the patient, but it will impact also the physical, the mental, the emotional, and even the social care and the social health around these patients. So upon my returning to Mexico, I made it my mission to improve access to care. initiated not only with a diagnosis, but also with a proper and timely approach. And the only way to do it is if you have the possibility to look beyond the initial and the obvious clinical diagnosis. That means that we need to pay attention as physicians on how your patients feel, how and what does the family or the people around the patient is thinking. You need to listen, to understand, and to develop trust with them and their families. So after I returned to Mexico, I had the opportunity to treat a patient with hemophilia. At that point, he was 2 years old. He traveled with his mom for 16 hours far away from Mexico City because he was unable to walk. This was because he had experienced a lot of bleedings during his short life in these 2 years. And it was not only the difficulty to walk or to run as any other kid, it was also the pain. But it's not only the physical pain, it was also the emotional pain. So when I saw him, it was so easy to make the clinical diagnosis. But the really interesting came when it was to come to do the emotional diagnosis of the family. So when talking to the mom, she was sharing with me that in their town, it was so usual to see the men like his kid. They were not even able to walk, to work, or even to do a social life. She saw it in her brothers, in her uncles, in her cousins, and even in her father. But she was not allowed and she was not convinced on letting his son to live that same experience. So that's why she decided to come to Mexico City to look for another opportunity for his kid. We started treatment, and after 6 months of comprehensive care, the kid started to walk and to make a more normal life. So they decided not to go back to their town just because of the threat that they will be pointing out, because they will be different of what was expected to be normal in their own situation. Today, after 6 years, he's an 8-year-old boy that is going to school and runs and plays as much as all the kids must be doing. So I am convinced that when it comes to access, diagnosing rare diseases, and researching treatment options, everything comes back to listen to the patients and to be empathic with their needs. We treat patients and not diseases. That's something that we as a physicians, we always need to have as a standard. But to do so, we really need to get close to our patients, to their families, and be really empathic with them. That's what brought me to Sanofi 1 year ago. Today, I do not take direct care of patients. I take direct care of the science for those patients. It's my job, and I really enjoy to give the translation of these needs of their patients to the researchers and the scientists that we have in the company, so they can really make better options to our patients. Previously, while being a pediatrician that treated kids with rare diseases, and now as a caretaker of the science, I have the experiences that remind me daily that we can teach and learn from our surroundings. It's our responsibility and our promise that each one of us should share our knowledge, because when we are joined, we do more. And as Shannon said, we need to do better and to do more. And the only way is if we are together, and in that way we will make an impact. But because this has been the driver of my professional and my personal life, I would like to share this thought in my mother tongue, in Spanish. And I hope that people that is Spanish speaking can enjoy it. Antes, cuando era una pediatra que trató pacientes con enfermedades raras y que hoy me dedico a cuidar de la ciencia para estos pacientes, tengo experiencias que me recuerdan a diario lo importante que es aprender y enseñar a la gente que hay a nuestro alrededor. Creo que es nuestra responsabilidad de cada uno de nosotros poder compartir lo que sabemos, sumar, porque solo juntos vamos a hacer más y solo juntos vamos a poder crear un mejor y un mayor impacto. Now, it is my honor to introduce to all of you Flaminia Macchia. She's the Executive Director of Rare Diseases International. She joined Sanofi in June of 2020 with the promise of being a strong voice for people living with rare diseases around the world. Flaminia, we are excited to hear more about you and Rare Diseases International.
Thank you, Dr. Cano. I'm pleased to join you today to celebrate Rare Disease Day. So My personal tie with the rare disease community, well, it's both professionally and personal. So at the personal level, I am a rare disease patient, and or more accurately, a person living with a rare disease. And on a professional level, I've been working for 20 years now in the rare disease space. I've been 5 years in a pharma company, well, actually in the pharma sector. And before that, I was for 15 years working at Eurordis. So now, since 6 months, I came back to where I belong. RDI. So RDI is the global alliance of persons living with a rare disease and their families across all rare diseases and of all nationalities. Our members are patient-driven organizations that work to improve the lives of people with the rare disease around the world. So the RDI vision is really a world where persons living with a rare disease and also their families would experience an overall better and improved life, certainly through better recognition and support, and also through improved health and social services. An essential part of our work is really to bring the needs and expectations and challenges of people living with rare diseases to the international fora and in global initiatives and global programs. So we want to ensure that the patient perspective is heard, and also the voice of those who have less opportunities to be heard at global level. So we are not about advocating instead of our members at national and regional levels, but actually we work at global level on behalf of our members. And so we really want to provide a platform to empower patient representatives to speak and act at national and regional levels. So yes, so the capacity building, empowering our global community to act locally, regionally, and globally is really at the heart of RDI's capacity building program. So we facilitate a certain number of priorities. So first of all, knowledge sharing amongst patient groups. We also want to ensure that patient advocates from low and middle income countries can benefit from the international platforms, and that they have the support that they need to participate meaningfully. So this capacity building program includes different tools. So for sure, fellowship programs for workshops and conferences, but also support conferences that our members might be organizing in their countries or at the regional level. And we also propose capacity building webinars on specific topics. And we want to develop more mentorship between different patient groups that might support each other, and also some short-term exchanges. So over the last years as well, we have been collaborating with the team of the Rare Disease Day campaign to ensure that our members can co-create the campaign globally together. So we are translating advocacy materials, as you know very well, in more languages, so to improve our outreach and support the local activities. Another exciting recent development is the launch of the RDI member-led workshops. So a series of training sessions that are initiated by our members to support other rare diseases organizations. And so everything comes from the fact that there is a wealth of knowledge within our community and that RDI aims to facilitate this knowledge sharing and mutual support. So some key programs that we're currently working on. So we are leading a global campaign for the adoption of a UN resolution to address the challenges of persons living with the rare disease. So we have been working substantially on this priority for us. And we have a draft resolution that we are we are going to start sharing, that basically calls on countries to recognize the specific challenges faced by persons living with rare diseases, and also calling on members to adopt national measures and ensuring inclusion and full participation in society of everybody, all people. So that means also persons living with the rare disease. So we are really positioning this as a human right priority. We are also collaborating with the WHO. We have a memorandum of understanding with the WHO, and we are working towards developing a concept model for a collaborative global network of centers of expertise on rare diseases. At this stage, all our member organizations have already helped the mapping of the needs of the global rare disease community to input into this global network, to position the concept of a global network to be patient focused. So we are also active in other international collaborations. You might know the Global Commission to End the Diagnostic Odyssey for Children with Rare Diseases. And we also work through our representatives in the IRDIRC, so the International Rare Disease Research Consortium. Well, this is what I can say for today. Thank you for inviting me.
Thank you, Flaminia, for sharing the importance of connecting the global rare disease community. You made some incredible points about the role of each and every person in the global community. There is power in unity. And Vesna, Dr. Cano, thank you both also for inspiring us on how each one of us has a role to play. Sharing a piece of personal commitment, I can say that growing up in France with both parents being physicians, I gained early a sense of the healthcare system, which were even brought one step further when, as a teenager, I became a rare patient myself. Later on, after a teacher and mentor inspired me to chart my own career ambitions, I decided that I would study to be a pharmacist. I followed my ambitions to have a bigger impact on more patients, and this is what led me to industry. I've had the unique opportunity and chance to experience many of the roles in the rare disease community, and what I learned is that it truly takes a village to support and treat patients. Now, we have a few questions that we're going to address to both Dr. Cano and Vesna. So maybe one question first for both of you. So maybe Vesna, you can go first, and Viri, you can go after Vesna. Do you have any advice for others as they advocate for the rare disease community?
Well, first, they should never give up. They should not be afraid. And of course, they have to get educated, because it is very important to be an educated patient. When you go to negotiate with institution, you have to know how the health system works, because you need to offer up solutions. Imagine that the Ministry of Health has a lot of problems from a lot of people, so they don't have the solution for everything. If you offer up solution, it seems that they will accept it if they like it, of course. So offer up a lot of solutions that you think they can be for your problem, so it can be resolved. Yeah, definitely.
Yeah. In support to Vesna, I may say, fight for it because you deserve it. If you're a patient, fight for your treatment. If you're a physician or a fellow, fight if you want to learn more. It might be that in our situations, we may not have all the tools to be updated, but just fight for it. When it comes to work with companies, we might fight together so patients can get what they deserve. And as I have said, please keep in mind that we do not treat diseases, we treat patients, we treat people, and that people has more people around it. So the impact is greater than the one that we can imagine. So in just one word, I may say, fight for it. Yeah.
Thank you both. Maybe a second question related to motivation and inspiration. So you both have tough days, and I guess people would like to know what motivates you or inspire you when things are not going so well. So maybe Sam, Vesna, you can go first, and Viri then.
Oh, this is a difficult question because mostly every day I get calls from people who have problems. Some patients don't have access to treatment. We can fight for access. We can get the access. But for some patients, there is nothing in the world that can help them in this moment. And you need to offer up some kind of hope that things can get better in the future. But what motivates me is when I get pictures and I get some little notes from people who got treatment and got their life better. Like yesterday, I got this very beautiful picture of a baby. So it's a girl, and it's from a patient with Gaucher disease from Macedonia. She was just a little girl when we started fighting for treatment, and today she's a mother, and she sent me this picture saying, "Vesna, I just wanted to say thank you because of you now I have this beautiful child, and I'm very happy that I got treatment and I got to live my life." So these are the moments that give you motivation to just continue further and further. The happy faces of people receiving treatment. I also have some, drawings from MPS 4 children who got treatment, and that's like, they're just sending you stuff because they like you, because you help them, and this is what gets you going a day after day after day.
Thank you very much, both. So maybe one last question for each of you again. What is your wish for the rare disease community in 5 years from now? And let's begin maybe with you, Vesna, and Viri then.
Oh, in 5 years, in 5 years, I would like to see available treatment in all the world. This is what I want to see, because when I'm seeing pictures of people not getting treatment, when I'm receiving news of people dying because they didn't get treatment on time, I'm just, I want to get out of my body and fly away. So that's one thing that I want to see. But I also want to see more research in rare diseases, a lot of research, because 5% is not enough. We need more treatment. We need more drugs. We need to make people happy. We need to make future for these families with rare diseases.
Yeah, adding to Vesna, it's so funny to see how we can mirror our expectations and our desire from each different of the perspectives. So my wish for the community with rare diseases, even it comes to patients, to HCPs, to pharmaceutical companies, to payers, is that they can have access, if not for a total cure, because as Vesna said, research advances, but there is a lot to be done. So sometimes the speed of the advances in research cannot go at the same level on how the patients are living. But my advice or my wish is that all of these patients can have access to something that can help them to have a good quality of life, while the research and the work of all around the people can really give them the opportunity to take back any single disease or any single rare disease. I don't like to call them rare diseases just because it's a few people. That doesn't make it a rare. It's just a disease. So my wish is that we have access and that they can have the opportunity to live the life that each one of us would choose That's my wish.
Thank you so much, Viri and Vesna, for addressing those questions. In closing, I would like to re-emphasize that it will take all of us, a global ecosystem filled with the voices of patients, caregivers, scientists, advocates, doctors, and healthcare systems to make a difference for the more than 300 million people around the world living with a rare disease. Together, we must continue to develop new, innovative medicines to treat rare diseases. We must advocate for equitable access to medicine when therapy is available. And we must provide education and resources in an effort to shorten the long, difficult journey to a diagnosis. But most of all, we must keep patients' voices, stories, and needs at the center of everything we do. On behalf of Sanofi and all the 100,000 of our employees around the world, this is our pledge to the global rare disease community today and every day of the year. We are all united behind a common goal to improve the lives of those living with a rare disease. Thank you for joining us today.